Hello and welcome. I'm Anand Naidu sitting in for Riz Khan. Every once in a while we hear what could only be described as a Cinderella story. And that's the story of our guest today. Liya Kebede was spotted in her native Ethiopia and introduced to the world of international supermodels in 2003. She's done work for designers like Donna Karan, Dolce & Gabbana and Chanel. And she became the first black face on the Estee Lauder label. In addition to being a supermodel, Liya also devotes her time and energy to some urgent humanitarian issues. Don't forget, we take your calls on the show. You can reach us there at the numbers at the bottom of your screen. Liya joins us now from New York. Liya, welcome to the show.
Hi, thank you.
You are a supermodel, a fashion model. You've been on the covers of some of the world's biggest fashion magazines. But now you've set up a foundation that looks at the interests and cares for the health of mothers and their babies. How did that come about?
Well, the thing is, I grew up in Ethiopia, and I grew up knowing that unfortunately childbirth is a very difficult process in the poorest countries, and because of a lack of basic medical care for women and children in the poorest countries, a lot of women die from pregnancy and childbirth complications. And complications are very simple things that are completely treatable or preventable in our case, because there are things like an infection or a hemorrhage that can actually kill a woman during delivery. And I am a mother myself. I have 2 children, and I was lucky enough, to deliver here in New York City. And when you're pregnant here in the West, you have the chance of not just having a very healthy pregnancy and childbirth, but also even to go as far as knowing if you're going to have a boy or a girl, or the technology is so advanced. And then in the poorest countries, actually childbirth is a cause of death for a lot of women and children. I think that the gap is so huge that when the World Health Organization approached me with this and told me that the statistics, which is like every minute there's 1 woman who dies from pregnancy or childbirth complications, I just thought that I had to put myself with them and help and do whatever I can to this. So that is how this whole thing started.
And you set up the foundation, and the foundation is called the Mission of the Liya Kebede Foundation, right?
The foundation is called the Liya Kebede Foundation, dedicated to women and children. And the reason why the foundation started was because as an advocate for the WHO, I would go on interviews and try to bring awareness to the cause, and everybody would want to know how they can contribute to help. And the WHO, works from government to government. They don't really take donations from the public. So I thought I would start the foundation to help people help us, and focus on things like training skilled attendants, so that women can actually have a trained person next to them in case of emergency cesarean or prenatal care and postnatal care, and things like helping equip hospitals. And also it's really important to educate women and girls, especially about safe motherhood, safe sex, and all those things.
So from what you're saying, these conditions that afflict people in the developing world are preventable conditions.
70% of those deaths are preventable. You can either treat them or you can prevent them. For example, a woman would die from an infection during delivery, or she would die from a high blood pressure, or she would die from a hemorrhage during delivery. These are things that you don't really die of here because you have access to a hospital, to a doctor, to an emergency care if you need it. And they don't. They deliver, the closest hospital could be like miles and miles away. So they don't even go to hospitals. They would deliver in their huts, probably no clean water. And if they do have a midwife, it would be just an older woman who has delivered babies, but who's not really skilled in taking care of, emergency situations. And a lot of those girls who get pregnant are so young when they get pregnant that they cannot, if they don't die from the pregnancy, and if they don't lose their child, because there's 3 million stillborn babies every year, and also their child can die from very simple and treatable things. Again, he can die from malaria, he can die from diarrhea. I mean, it must be so horrible to lose your child to diarrhea when there's so many other things that we have medication for that. And if they are healthy, and if they do survive this death, they can have horrible illnesses such as fistula, because they don't have access to a cesarean when they're delivering.
I want to ask you about that, obstetric fistula. That is a disease which is very prevalent in the developing world. What exactly is it?
Well, a fistula happens to a woman who, well, a girl usually, well, girl or woman actually, because most places, for example, because of malnutrition already that is, rampant and stuff, the girls who are pregnant, who probably are, when they get married, they're about 10, 11, 12, because early marriage is really very common in poor countries. Even though there's laws against early marriage, I think it's very difficult to change culture and society to execute that law. And so when they do get married at 10 or 11 and they have their first sexual experience, they're going to end up being pregnant because they don't really have safe sex, because they don't really know about safe sex and they're not educated. And then, so they're what, 11 and 12, they're pregnant and they're trying to deliver. And let's say the baby's head is too big and she's tiny with her tiny frame, the baby can't come out. And so she doesn't have a hospital to go to, so she'll be in her hut trying to deliver all alone, and she'll be in labor for days because the baby cannot come out. There's no way for this baby to come out unless you have a C-section. So 4, 5, 6 days later, after that, all that horrible pain for her, and she has no medication to help her through this pain, by the way, her baby dies. And then the head sort of collapses and finally the baby comes out, dead, of course. So now she has a stillborn on her hand. And with all that pressure of the baby on her body, a hole gets created and she becomes incontinent. And so she leaks urine and she starts smelling and she is left all alone. Sometimes her families abandon her because they don't really know how to take care of her, and she's a burden to her family, to her husband, who might go off and marry somebody else. And here she is, this young girl who's 12 and her life is over. And fistula is a very simple procedure to fix. Actually, there's a hospital in Ethiopia, an Addis Ababa hospital, with Dr. Catherine Hamlin, who has taken this as her life mission to fix girls who have fistula. And it's like almost a 98% success rate, and these girls can go back and have a life and even have children again. Except they just have to they have to learn when they're pregnant to go to a hospital and make sure they deliver in a hospital.
So some progress is being made there. Let's go to the phones. We have one of our viewers calling from Kenya, Yusuf from Kenya. Go ahead with your call.
Yeah, I want to ask you, Mrs. Liya, that she said that her family are settled in the West. So I'm asking her, is she going to build her home in Ethiopia instead of settling only her family in the West?
I live in the West. I mean, I work as a model, and I used to live in Ethiopia. I grew up in Ethiopia, and I came to America when I was about 18 years old, and I've been living here since. And now I have my family here. My life is here, but I always go back. And actually, we're planning to go for Christmas again, and I'm very connected to Ethiopia.
Well, you also work as a Goodwill Ambassador for the United Nations. You've been telling us about that for the World Health Organization. I just want to play a little clip from some of the public service announcements that they have been putting out. Let's take a look at this.
Every 3 seconds, somewhere in the world, a child dies. Every minute, a woman dies giving birth. That's more than 10 million deaths a year. And most could be prevented with the most basic medical resources. Let's do something about this now.
Now, that was an excerpt there from a public service announcement which is put out by the World Health Organization. You, as you pointed out, you go back to Ethiopia quite often. You've been working among people, among mothers and children with these particular afflictions. What kind of progress has been made?
Well, there are progress, but it's really difficult because I think that the women dying from childbirth, it's kind of not a new phenomena. It's been going on for a long time. So I think in terms of priorities, it's not necessarily on the top priority list for a lot of countries. And I think that's really one thing that we really want to encourage countries and local governments to do, is to really start budgeting, a good amount, a portion of their budget to maternal health, to making sure that women get access to basic medical care and their children. Because at the end of the day, I mean, the woman is the one that's going to take care of her family. If a woman dies, the survival of her kids is just, kids have difficulty living without their mothers, especially in those kind of areas. And we really want to push women and girls to get to school and stay in school and really be able to, graduate high school and college so they can make their own decisions about their life, about their husband, about their children and their family. I think there's a lot of work to be done. I mean, it's wonderful. There's a lot of movement. There is a lot of movement, which is great, but we really want to encourage more, because even the international community needs to start focusing a lot more on maternal health. It's one thing that is not being done right now.
Well, we've just got an email here that's come in about that very issue that you were talking about the amount of work that has to be done. This is from Els Moudib in Belgium, and he writes, do you feel that your efforts are a drop in an ocean of misery? Ethiopia's past is full of conflict, and under an unstable regime, it is very hard to provide basic needs to the population.
No, I don't. I don't think that, because I think the more, when I see here all the support that we're getting, trying to make a difference for maternal health in the poor countries, everybody really gets touched by it. The more people know about it, the more they're touched by it. And I think we are really making progress. I think there's a lot of communities that do help, that are concerned about maternal mortality. And just now, even at the Clinton Global Initiative, there was a whole panel on maternal health, which is really wonderful. And I think every little bit that you do really counts. And I think I'm very positive about it. I think we really are going to make a difference.
Now, let's talk about you for a minute. You are a mother. You have 2 children. You're also a supermodel, and you're doing this humanitarian work. How do you juggle all of that? It must be quite a balancing act.
Yeah, I don't know if it's balanced, but it's kind of like I do whatever comes today, and it's been really wonderful. I feel really grateful. It's very, fulfilling life. I'm really grateful to be. And also, like, having children just makes you see the world so differently and makes you feel so responsible, and which has been really, really wonderful. And at the same time, the fact that I've been, fortunate enough with my work in my career has helped me to have this platform to be able to give voice to other women who don't have this voice.
When you say there's been a change in your life, you see the world differently. Did that happen when you had your own children? Was it more sharply focused then?
I think always when you grow up in a place like Ethiopia, and I think probably if you grow up in the third world, you do grow up wanting and knowing that you have to do something at some point in your life to give back, and it's something that's always been with me. But I know that when I had my kids, it really makes you see the world very differently, and you start thinking about. It makes you less selfish, I guess, and makes you think about the world, and you want to know what's going to happen in that next 100 years. You don't just think about today and tomorrow. And you want to make sure that your kids are okay and your grandkids are going to be okay and the environment is going to be okay. So it really puts the bigger picture, I think, in your head more. And so it has helped me in that and made me want to help others. And that's why when you see women, for example, losing their kids, and it's an unnecessary loss because you can treat or prevent it, it's just a lot more painful when you know that you are lucky enough to have a healthy child, So.
Do you find that you're more sensitive to the problems that you're talking about in the developing world, the problems that women and children experience, and are more effective really as an ambassador because you actually come from that part of the world?
Probably. I do. I feel that way, yes. I feel that way. I guess I'm sort of attached to it. And also when you think about it, it's just because you're lucky enough to be born on one side of the world versus another, the choices that you have in life are so gigantically different that it just doesn't make sense.
You have people like yourself doing something about these problems. You have the United Nations that's doing something. Do you believe that Western nations should be doing more?
I don't think you can do enough. Because there's so much to be done. The gap is so huge that we have to do more.
Tell us about some of the more practical things that Western nations can do.
Well, they really have to start budgeting a lot more for maternal health and really have to help in trying to fight and eradicate things that are completely treatable or preventable. children should not be dying from malaria anymore. Children should not be dying from diarrhea anymore. It's just not right. And these are things that we know how to do. We have the cure for them, or we know how to prevent them or to treat them. So at least the things that we know how to do, the things that we know how to stop, we should do. And we need we need to focus on that.
Okay, Liya, thank you very much for being with us. Good luck with your foundation, and continue the good work. Thank you very much. Thanks for being with us. On the next show, that'll be next Monday, Riz will be back, and he'll be speaking with award-winning author and activist Alice Walker, who became the first African-American woman to receive the Pulitzer Prize for her novel, The Color Purple. Don't forget, if you have any thoughts about pressing issues around the world, send us your emails to riz@aljazeera.net. See you next time. Street Talk is next.